watching Parker Success Academy with Dr. William E. Morgan.
Hello, I'm Bill Morgan, president of Parker University. And today with me is Tera Giroux. And Tera has a very interesting story. And we're starting this series on the business of chiropractic. And even though her story transcends just the business side of chiropractic, it was an interesting story. And I just wanted to bring Tera here and introduce you to her and for her to tell her story. So Tera?
Thank you so much, Dr. Morgan. I'm really excited to be here and talk with you today.
Now, you've got an interesting story. Can you tell us a little bit about where you are and how you got there?
Yeah, of course. So I currently work at the UFC Performance Institute in Las Vegas, Nevada. We have a team of about 15 of us who are kind of working all together, all from different backgrounds and different departments. We have a strength and conditioning department, a sports medicine department, a nutrition team. We have sports scientists and sports psychologists on staff. So it's a true interdisciplinary model that we strive to help out with our UFC athletes for to try to help support them in their endeavors to be champion.
Is it as exciting as it sounds?
It's pretty cool. I can't even lie. Every day I'm still pretty in awe just walking through the hallways, Hall of Famers crossing me by and just incredible athletes and their dedication and motivation to just be that 1% better every day is super inspiring. So not only that, but my team, I get to work with such smart, incredible people and leaders in their respected fields. And I'm constantly learning, constantly pushing myself out of that kind of like chiropractic bubble to expand my knowledge and just better myself and better understand what it takes to really become an elite athlete. So it's been an incredible journey so far. I've been here for about 1.5 years now. I was in private practice for about 5 years before that, but this was always the dream. And it's just surreal that it's here and it's still daily. I can, really get excited about what I do and being here.
So you graduated about 6 years ago and
yes.
Went to practice. Did you have a sports specialty that you were working or just general chiropractic? What was your practice like before?
So the first practice that I was in, it wasn't your typical just adjustment. We did do a lot of soft tissue work. My boss at the time was an ART instructor. So it was kind of like an ART, little bit of nutrition, just adjustments, kind of about 15-minute appointment model. And I always knew that I wanted more time and I needed more time. And I was taking all these seminars and didn't really have a good chance or enough time to really apply all of it or to take my time with the patient. So I knew I wanted to be in a model that reflected, my skill set and my goals and how I really felt like I wanted to practice. So after about 1.5 years of that, I got a new position. I moved all the way to Seattle.
Where were you at before?
I'm sorry?
Where were you before? Where did?
Oh, I'm sorry. I was in North Carolina before. Okay. So just the small town in North Carolina. I did do my internship with the chiros, who are the chiros for the Carolina Panthers. So that was my real first experience. Dr. Coleman and Dr. Weiss. Mm-hmm.
Yeah, he's spoken at Parker seminars.
Yeah, they were wonderful. They have a phenomenal practice, very athlete centered. That spent that extra time, had a multidisciplinary setting too, where they had acupuncturists, massage therapists, and strength coaches and a PT. So it was really cool to see them work all together. And I knew kind of right during that internship and preceptor, that's kind of how I wanted to practice. I just couldn't find anything like that, I guess, right off of school. So I took this other job and it was a learning experience. I think your first year out in school, you're definitely just kind of taking it all in, trying to learn the ropes, get comfortable, get a routine, learn the insurance side of things. So as much as it wasn't my ideal practice setting, I can't say that I didn't learn anything. I think you take all that with a grain of salt and try to absorb as much as you can. Maybe sometimes you learn what you don't want to do more than what you want to do. And I think that's totally okay. I think
hear that often.
Yeah. Yes. So yeah, the internship was awesome. The first job, learned a lot, but then I kind of like was like, okay, I know exactly what I want to do and how I want to practice now. So I took that big leap out to Seattle, and I out there I worked with the docs for the Seahawks, Dr. James Kurtz and his team, which were incredible. And just the West Coast has such a different vibe with like just alternative medicine, and they're very like athletic and just a healthy population. So it was really cool. I kind of was able to take that time that I needed to grow and to really develop, and had awesome mentors there, obviously, and just kind of went ham with seminars. I'm a seminar junkie. But the way I kind of approach that is, if I can just get one thing away from them, from each person who's teaching, like, and blend it together to make it my own. That's kind of the way I approach seminars, rather than sticking with one thing or being like a really good or guru, I guess, at that. And
So,
I guess maybe that's why I have such a big toolbox now.
so seminars, you're talking technique seminars, making you a better
Yeah.
practitioner?
Yeah, I guess technique seminars, kind of stuff away from school, whatever you want your focus to be. There's so much stuff out there now. And even getting out of like, chiropractic bubble, like going to more of like a strength and conditioning seminar or something like that, just to kind of like expand your knowledge. Because even if that's not the route you want to go to, you're probably going to run into a patient down the line where maybe, they're working with, or they're a pro sports team, and you need to like know the lingo at least to talk to their coach, or to talk to their MD, or to talk to whoever it is that's on like their team. So I think it's really important to, if it's not your jam, to at least attempt to like understand different principles and different people and their ideas, because it's about the patient at the end of the day. It's not not really about you.
So how did you get the call? How did you get this gig?
So this gig, I'll be honest with you, it was, usually stuff like this, you have to know somebody, right? It's a friend of a friend makes a referral. But I felt like this was a cold call in some way. It was just a job posting online. There's a job site called Teamwork Online that a lot of the sports teams post their like job postings and internships and stuff on. So I would browse that once in a while, and I saw this position come up and kind of went through, and I was like checking all the boxes, and I was like, I mean, I guess I'm kind of qualified for this, but I don't know. There's no way they're gonna like hire me. I don't know. Just, you doubt yourself. But after a few days of mulling it over, I was like, just apply. You have nothing to lose. And so I did. I sent in, my application, my resume, and it was a grueling 6-week wait, but then they finally called, and we did like a Skype interview at first. I guess they had over like 150 applications, and I think they picked about 10 to 15 to do a Skype interview with. And then I waited another month, not an easy waiting process. And I got another call, and they invited me down to Vegas to their facility to meet the team and to just see if I was a good fit. And everything was just so laid back. And, I could truly tell that they were just really interested in me and my personality and how I would blend with the team and my vision and goals, and if it would blend with them. And and 2 weeks later, I got the call to get on down here. So here I am.
That's awesome. In my background is I work with Navy football, and I got into that by I would do lectures, and also seeking clinical excellence is, and also be a team player. I know Navy, when I went in there for Navy football, there would be trainers, strength coaches, athletic trainers. They didn't need an orthopedic surgeons. They didn't need me to come in there and tell them how to do their jobs. In fact, they had others come by, and frankly, they didn't like having physical therapists in the training room because they tried to dominate instead of collaborate. And collaborative care is something we really seek. Clinical excellence, collaboration. This is just a model. And as we start this series on the business of chiropractic, it's interesting that we start off with clinical excellence rather than practice management. As the focus is, it doesn't matter how good your business is if you can't adjust, if you can't get somebody better. Yeah. And I think you like the concept of enhancing performance rather than treating disease. And that's your, would you say that, or did I put words in your mouth?
Yeah, I mean, just I guess with an athletic population that I'm pretty much only working with at this point, it is about enhancing performance, right? We want to kind of clear that path so that they can run that path and get to the finish line, so to speak. So yeah, it's about performing enhancement. But at the end of the day, these athletes are super healthy, pretty much for the most part. So I don't have to worry too much about the weird stuff, which was really nice. But I will say, if I didn't go into private practice for 5 years, I wouldn't be able to catch the weird stuff when they do come around. So I think that, they do blend together. Maybe some days it's more one rather than the other, but I know I've caught random stuff. I've caught a Marfan's here. I've caught there's weird diseases and looking at staff and, things like that. And just having that background, I think is still really important regardless of being in this setting now. Does that make sense?
It does. Do you think
Yeah.
there's a future market for chiropractors who specialize in strength and human performance?
Absolutely. I was very lucky. My team, my sports medicine staff here, they both worked at the USOC. So, very saturated with chiropractors there. And I think that they were able to see, what a compliment that was to their skill set. And, when you do come into our treatment room and you watch me and you watch my PT and our athletic trainer treat, you really couldn't tell who was who, like if you didn't know better. We really try to all learn together and to kind of, not have the exact same technique because everyone's unique, but just, be really aware of what our goals are. And because if someone's treating way differently here and there, that can get a little messy. You can start to get favorites, and that's not really what we're trying to do here. We really want to be a true team, a cohesive team, something that any of our athletes can go to and feel really comfortable seeing everyone. Of course, we all have like our little niches, like, yes, I do adjust. And, obviously that's my thing, I would say. And then, our athletic trainer is amazing at taping and wound care and emergency medicine. And our PT is like a bomb post-rehab person. So we all have our niches, of course, but like at the end of the day, I think we all just work so well together. Like you couldn't really tell. And that's what I would love to see more of, is kind of leaving that ego at the door and really being able to check yourself and being like, okay, if this adjustment isn't working, like how can I help? It's about the patient, right? So what do I need to do? If my skill set isn't working, and that's going to happen, and that's totally okay, but you have to be humble enough to know, like, hey, let me go and have this, pull in my associate doc and have them take a look. Or why don't I refer you to this person? They're better at this than me. Or like, the adjustment's not working out. I think you really need soft tissue work. Let me refer you to this person who specializes in soft tissue, or a massage therapist, and work together. Because again, it's about the patient, and sometimes that adjustment, although is the most powerful thing, I think, isn't quite enough for that one person. So definitely knowing how to step outside your boundaries and be comfortable with referrals or collaborations or whatever it is, I think is super important.
Well, I agree. When I've worked in a collaborative environment most of my life, and the thing is I was at a hospital with 2,000 other providers, and there's only 2 chiropractors. So if you're going to get an adjustment, I mean, the adjustments kept me busy all day long. I didn't dabble in other things because we had physical therapy for rehab. We had orthopedic surgeons who were doing orthopedic care, physical medicine doctors, but there's only 2 of us that were adjusting. So we better get our adjusting, and then trade off. If somebody needs rehab, I've got a physical therapist we can collaborate and communicate with. Now I've got a couple questions. I run the largest chiropractic seminars in the world. You're a seminar junkie.
Yeah.
And I try to have chiropractic adjusting whenever I can at our seminars, because I think people, once you leave chiropractic college, their skill set, you don't keep getting refreshed in your adjusting. So I try to have that. What would you like to see at Parker seminars? What would somebody like you, what would attract you to our seminars?
So for me, and just like my wants and goals, I would love to see like just an awesome panel of, like, just personally, like someone in the sports world, whether and like completely different principles, and how and hopefully people that work with chiropractors, and not just, if they don't work with chiros, it's almost, I don't know how much we'd get out of it if they can't connect with us like that. But like someone like a panel of just multidisciplinary people who like work in different settings with different chiros to see how they all work together and like how I guess they collaborate and on a daily basis
Do you have
and
any
how that
names?
looks versus a private practice versus a hospital setting versus a pro sports team, something like that. I think that would be really cool. And then obviously always having some more rockin' females on the panels is always
That's
enough,
what we're looking for. So, and actually, we want more diversity in chiropractic seminars. It's a very, we realize there's a lot of white men on the platforms, and we're trying to diversify, and looking for those people who can come in there and be the role models for other young chiropractors. What would you tell a young Tera who just was graduating? What advice would you give yourself if you were to go back in time 6 years?
Oh my gosh. Don't spend so much money on your student loans. Don't take so much out. Kind of budget, I guess, for things you want to do, like seminars or a vacation or, lifelong goals. Kind of make sure you talk to like a financial advisor. I think that's a whole different, subject, but super important. And then I would have said also like take as many seminars as you can during school because of just how cheap they are. And I think what's really great about that is that you can go and practice them in the clinic on Monday, and you have a little bit more wiggle room to mess up in the clinic rather than in the real world. You got someone watching you and checking you. So being able to like take a seminar on the weekend and then go and practice it first thing Monday, but like take your time with it. Cause I remember like that first year being in practice with only my 15-minute appointments. Like I'd take a seminar, but then I couldn't really go through the whole SFMA flow, or I couldn't really take them through a whole McKenzie assessment because I only had like 15 minutes. So I would have loved to be able to like nail all that stuff down when I had the time in chiro school, working with my peers, working them up, or, just taking that, you have, I think usually like a whole hour with a patient in clinic, or at least we did. So that would have been really, really helpful to just learn and trial and error in like a safe setting in a way.
Great. Well, we talked a little bit about strength and human performance. We just started 2-degree programs on strength and human performance, a master's and a bachelor's degree. And our chiropractor students can get that concurrently while they're in chiropractic college, has a scholarship. And right next door to us, we have a 21,000 square foot human performance center we just built. We're still putting the equipment in it. Nobody has worked out there yet, with a human performance lab. And then across the street, we have Synapse, which is our human performance center, which focuses on neurology. We're combining those together and hopefully making a place where we attract high-end athletes to come, get their people who've had TBIs, and combined neurology, strength and human performance, and the chiropractic adjustment. And the synergy of it, but we'd like to be the experts known for that. We'd love to have you come to campus. You've already spoken to our students and they loved it. We'd love to have you come back and be part of our seminar team. So we want to hear your story. Anything else you'd like to share? What's the most interesting thing you found at UFC?
Interesting thing I find, like clinically?
Yeah.
Oh gosh. I mean, I've seen some, it's kind of crazy. It's opened up my world so much more than, I think you learn about this stuff in like school and for boards and things like that, but it doesn't really come into your office, like in a private practice at least. But here, oh my gosh, I've seen crazy skin diseases, like big boilers from staff that we've had to drain. I mean, I've had cuts, we've had to, stitch people, we've had to drain cauliflower ears, like just random stuff that you wouldn't even believe, like bad cases of folliculitis and, gosh, man, so much weird stuff.
A lot of blood pus, it sounds like.
Not the cleanest. No, I'm just kidding. I think things that like I wouldn't normally probably do in private practice, working with an athletic population, and a little bit more into like wound care or emergency medicine. And if you're gonna work with athletes, even really, I think you should have a basic knowledge of just working with the general population, because you never know what someone's gonna walk in the door with. But that's been really cool to learn and to get better at, especially working in sports.
So we have students who'll be watching this. We'll have doctors in the field. They're jealous, of course, because this is exciting. But there's plenty of opportunities like this around the country, and some of the opportunities we need to make ourselves. So do you see so for someone who's watching this now and saying, I'd like to do something like that with a professional football team or a college team or, boxers or wrestlers or Olympic lifting teams. You mentioned going and taking all these seminars, but you had to take a few other steps to get here. A lot of people take seminars. You somehow had a resume that they liked.
Yeah. I do. I definitely, I think, that's the best way to put it. So, for example, pretty much every job that I got, I pretty much just reached out to them for. Like, there weren't really job postings up. I just found a clinic that I thought that I would really like to practice in, and docs that I would want to practice with. And I reached out. And I almost cold called, and I almost just put myself out there and was like, worst thing they can do is say no, right? But what if they say yes? And surprisingly, most of them were like, oh yeah, actually we are looking for someone. I just haven't had time to put up a posting. So I really encourage people to reach out and kind of go after what you want, or at least reach out to those people in an attempt to figure out how to get there, because most of the time they're going to be pretty cool with you. Like, really, they're going to want to help. They've been where you're at. Like, mentors are all over the place if you really look and you ask. And I think a lot of people are nervous to ask for help or for guidance. And, I wish that was less of a stigma, but, it's definitely the case. I think women in particular are very nervous to ask for help or to ask for what they want. I think it's just something that we do. We don't know why. I wish we'd break that pattern a little bit better. So hopefully I can, be that person for some of the future, female and male chiros coming up and wanting to do this. But yeah, it wasn't like I got out of chiropractic school and I was going to be a good fit for this job. It was putting in years of work of not only getting really good at my craft, but establishing relationships with, other disciplines, being able to communicate, being able to talk that lingo, just being a person that you want to work with, like a good human and a good teammate, and being very open-minded and not having, oh, I'm better than this, I'm better than you at this, whatever. I think that's a thing that we do sometimes. And it's just not the case.
You're saying being humble and teachable, but have confidence.
Yeah.
And so what I frequently will tell people is that confidence and certainty are not the same thing. I can be confident with my adjustment, but once you have certainty, you're not teachable and you're not curious.
Yes.
So you want to it's a fine balancing act to have that confidence to present yourself to the UFC and seek that job, while being humble enough to know I don't know it all, and where I'm pretty confident this adjustment is going to help this person, I still need to research, I still need to study.
Absolutely. Always. You should always be learning. I see a lot of docs coming out of school or even 10 years into practice, 15 years into practice, and they're still doing the same thing. And I would like us to be better as a profession, to really challenge ourselves to continue to learn and continue to grow, because the data changes yearly, the research changes, the technique changes,
the science changes.
Science changes. People want more, they expect more. If you're still practicing one way 10 years ago and this new guy down the street's way ahead of you in certain things, they're probably going to go there. So it's making sure that you're not just always comfortable. You should always be uncomfortable, always being challenging yourself, always striving to learn more and to be better, not only for yourself, because I think that keeps you wanting to do what you do when you're passionate about learning and being better, but also for your patients, because that's the most important thing. They want to see that you're bettering yourself, you're out there learning, you're trying to help them, trying to, learn the next best thing that might be able to help this person. So I do think, our profession gets a little stagnant and a little comfortable. And I'd like to see us push the boundaries a little bit more in the future. My
peers, I practiced for 33 years, but I've seen people who, what they learned in chiropractic college, they did that for 35 years. They didn't practice. They didn't have 35 years of experience. They had 1 year of experience. They repeated 35 times. Yep. I practiced much differently my last year in practice than the first year. And if you don't look back and say, boy, I really didn't know a lot about this when I started, I've come so far, always trying to go further and further. And there's, of course, your confidence level, you come out, when your knowledge level and your confidence level can be inversely proportional. There's a point when you first get out, it's like martial arts. You might have an orange belt who think they know it all. And by the time you get to your black belt, you realize how little you know and how much more you have to learn.
Yeah.
Tera, thank you so very much for coming. This has been a joy, and look forward to showing you our new UFC Performance Center when you come to visit.
I'd love that. Sounds great.
All right. Well, thank you very much.
Thanks, Doc. Appreciate your time.
Thanks for watching another episode of Parker Success Academy with Dr. William E. Morgan.